Fox Focus, a few minutes for a closer look.
Hello and welcome to Fox Focus. I'm Denise Kutterovic, and today I am here with Dr. Megan Graham from the Wisconsin Dental Association. Hi, Megan.
Hi.
Now, you are a general dentist in Milwaukee.
I am.
A member of the WDA.
True.
And we are here today to focus on GERD because the 17th annual National GERD Awareness Week is coming up. Thanksgiving week, by the way, November 23rd through the 29th. Right, when people tend to stuff themselves.
Absolutely.
So I think what we're trying to do is raise awareness on what GERD is.
Absolutely.
So why don't you tell us what it is exactly?
Absolutely. GERD is gastroesophageal reflux disorder, and it's a very common disease that affects 7 million people.
Wow.
It is caused by the sphincter in the esophagus not working properly and allowing stomach acids to come back up the esophagus and into the mouth rather than staying in the stomach where it should.
Right. I think people think that maybe GERD is something that affects adults, even the elderly, but who can it all affect?
It can affect anybody. Newborns can suffer from GERD and often do.
Wow.
It's very common.
Okay. What happens when it gets chronic? I guess it's happening more frequently or more severely.
When people have GERD and they are having frequent episodes of it, the acid can start to cause damage to the esophagus. It can cause severe sore throat, hoarseness. It can also cause damage to the tooth structure and the oral cavity as well.
Okay, and that's where the erosion comes in.
Mm-hmm.
Now, people would think I need to see a doctor because of this, and maybe that might be true, but they also should maybe see a dentist first, and why is that?
Well, oftentimes patients don't even know that they have it. It's not uncommon to have asymptomatic GERD, where the acid is coming up, but they're not suffering from any pain or sore throat or hoarseness. But we can look in their mouth and see that they're showing specific signs of acid wear on their teeth, ditching out areas where the enamel's a lot thinner and weaker.
Okay. And where do people go from there?
From there, if somebody came into my office and I saw these signs, I would then send them to see their general physician to talk about prescription medications, over-the-counter medications, maybe even do a scope to evaluate the esophagus. And then we'd also spend a lot of time talking about proper home care and what we can do in the office. It's wise for these patients to come in 3 or 4 times a year as opposed to twice a year so that we can
twice is the standard, but people with GERD maybe need to come more often.
Yeah, there's lots of reasons to come maybe more frequently, and GERD would definitely be one of those reasons.
To gauge the severity of the erosion.
Yep, keep things clean, keep the plaque off the teeth, so that there's not such an acidic environment. Maybe do fluoride treatments, talk about a prescription strength fluoride toothpaste, those kinds of things.
All right, sounds good. Well, let's talk briefly about some links that GERD has to things you wouldn't expect, like headaches, jaw pain, even broken teeth or tooth loss. What is the linkage there?
Well, as far as teeth go, as the acid weakens the tooth structure, the enamel, the teeth can become more and more sensitive. They become more and more prone to cavities, and they can be more prone to breakage.
Okay.
As far as the headaches and jaw pain go, there is an association of patients that suffer from GERD frequently also brush or grind their teeth, and also it can also be associated with sleep disordered breathing as well.
Wow, apnea. Okay, a lot of good information people can probably get from their dentist, right? Let's talk briefly about the importance of just general oral health. I know we have the holidays coming up with all the food and candy.
Absolutely. You know, we're constantly putting our mouths in an acidic condition, and we want to talk about ways to remineralize the enamel to prevent things from breaking down and keeping things nice and healthy. The most basic things in the world can keep things pretty stable. Brushing twice a day.
Brush and floss, right? All right, if someone wants to reach out to you, they can visit WDA.org and find you, correct?
Yep. There will be a Find a Dentist link on the WDA.org site, and you can find a local WDA member to take care of you.
Sounds great. Okay, thanks, Megan. And thank you for watching. We'll see you next time on Fox Focus.
Interested in appearing on Fox Focus? Email us at foxfocus@fox6now.com.